Welcome to the Health Trip Podcast. My name is Jill Foose. I'm a functional medicine and integrative nutrition health coach. I created this podcast to bring you along as we travel down intriguing, science-packed roads, debunking old medical paradigms and perusing new innovative therapies and modalities with the finest functional medicine doctors, practitioners, and like-minded biohackers while living our best life. Enjoy the show. Hi, everyone. Welcome back to another episode on the Health Trip Podcast. Menopause brings to the table a variety of physiological symptoms, including gut health issues. Women in perimenopause start to experience increased constipation, diarrhea, gas, and bloating. Other signs that a woman's gut may be in dysbiosis are hair loss, skin changes like acne, joint pain, and weight gain. How many of you have tried different medications, diets, and supplements to heal your gut? It's not normal to experience these gut health issues daily. I hear from my clients all the time that they've been this way since they were young kids or that bad stomachs run in the family. It's time to address your gut health so that you can focus on your fitness, sleep, nutrition, and optimal health outcomes as you transition through menopause or continue to enjoy your post-menopausal years. Ladies, you will be post-menopausal for hopefully 3 to 4 more decades. Let's figure out our gut health equations and live life to its fullest. My guest today is Leo Grady, the founder and CEO of Jonah Health. Jonah Health is an AI-driven gut microbiome company. Leo is internationally recognized for his work to deliver AI in healthcare for 20 years at pioneering Bay Area startups like HeartFlow, multinational medical companies like Siemens, and most recently as CEO of Page.ai. As CEO of Page, Leo led the company to become an industry leader, internationally launching groundbreaking products and receiving the first ever FDA approval for an AI product in pathology. He is currently the CEO in residence with Briar Capital and founder again of Jonah Health. And I think this is going to be a really interesting podcast because so many women in midlife, such as myself, don't really understand AI and how it can deliver information that is personalized so that we can pivot our lifestyle in a direction that is specific to our needs. A short medical disclaimer before we dive in. By listening to this podcast, you agree not to use this podcast as medical advice or to make any lifestyle changes to treat any medical condition in yourself or others. Consult your own physician for any medical issues that you may be having. And this entire disclaimer also applies to any one of my guests on my podcast. So sit back, open your minds, and let's dig into AI and gut health. Hey, Leo, welcome to the Health Trip Podcast.
Hey, Jill, happy to be here.
Yeah, I'm so excited to have you here to really break down AI and what you're doing in Jonah Health in regards to gut health. First, I think we should start out with just having you better explain what AI is and why it's in healthcare, because I got to tell you, I'm 57, I'm post-menopausal, and it's really challenging for me to keep up on all of the tech. And this is a huge space now. And as a health coach, it's something that a lot of health coaches really need to open their eyes to and not be afraid of learning.
Well, the funny thing is I did my PhD in AI over 20 years ago. And a lot of people think that AI is something that's new and that just kind of popped up in the last couple of years with ChatGPT. But in fact, AI has been part of our lives for quite some time in ways that people don't always realize. Fundamentally, AI is about using computers to analyze complex data and do tasks that we consider more intelligent, whether that's playing chess or whether it's winning Jeopardy, or unlocking your phone with a face recognition, or even recommending movies to you on Netflix or TikTok. AI comes in many different forms. And now some of the language models that people are using with ChatGPT or Claude or whatnot, it's a new form of AI that's maturing. But AI has been around us for a long time as part of our society.
I never really thought about it that way. So I've already been using it and I just didn't even realize it. But now it's finding a big place in healthcare. It's helping providers, physicians, practitioners ease up on having to fumble with keyboards and note taking so that they can pay more attention to the conversation they're having with their patients and their clients.
Yeah, I mean, me personally, I think my first FDA approval for an AI product in healthcare was probably 2005 or 2006. And that's not the first one ever. So it's been around for a while. But as you mentioned, a lot of the newer applications are around scribing and being able to listen to doctor's visits and being able to take notes automatically in a way that's of a quality that's really useful and clinical grade.
Yeah, actually, in health coaching, there's a tool that I know of that is AI that I just started using 2 weeks ago, where a health coach can go on and we can pretend that the AI model is a client, and we can present them with an issue we're having or a conversation we had with a client, and we can practice our motivational interviewing skills with the AI being the client. And it's amazing. And it has really been helpful in pointing out to me maybe where I need to become more stronger in some of my skills that I'm using with my clients.
Does it give you feedback too?
Oh yeah, it gives you feedback. It's unbelievable. It's really cool.
That's super cool. That's
Yeah.
great.
Yeah. So we're here to really focus on menopause and gut health and AI. And although you didn't develop Jonah Health for menopausal women, um, it can be used in a very positive and beneficial way for our population of women. You know, going through menopause, we are experiencing all these physiological changes. On top of that, there's just stress. And we know that stress is a huge player in our gut microbiome. We know in perimenopause, our gut microbiome goes through changes. And I wanted to get your um, thoughts on how women in this age population can benefit from Jonah Health's product, and maybe talk about your product.
Yeah, maybe I can tell you first of all what we do at Jonah.
Yeah.
And it's every aspect of your health has been linked with your gut microbiome. So it's not just gut health, it's skin health, it's brain health, depression, anxiety, Alzheimer's disease, all have been linked with the gut microbiome. Even cancer, obesity, liver disease, cardiovascular disease, every aspect of your health has been linked with the gut microbiome. But the challenge with it is that it's super complex. You've got 30 trillion organisms that live in your gut. It can change over time. It can change with, changes in your body. And the science is super fast moving. So every single month, there are more than 2,000 studies published on the microbiome, and nobody can keep up with all of it. And then furthermore, you can change your microbiome through diet and lifestyle and supplements and medications. And so all of this complexity is very difficult to understand and then figure out what you can do about it. So what we did at Jonah is we built an AI system to read all of these studies. We give you a gut microbiome test. So it's a stool sample, you send it
Mhm.
off to the lab. We do deep sequencing, we identify everything in your gut down to a strain level. And then the AI matches the patterns in your test results to every study that's ever been published. So you can say, for you, your microbiome fits the profile of everything from fatigue and bloating and brain fog, all the way to psoriasis or to depression or even Parkinson's. And then the AI goes a step further and reads all of the science on what you can do about your microbiome, whether it's diet or lifestyle or supplements. And we know, for example, like if you go vegan, it changes your microbiome in a certain way. And so what we can do is we can apply that change to your microbiome digitally and make like a virtual, vegan Jill and or virtual keto Jill or gluten-free Jill. And basically digitally give you every dietary change, every lifestyle change, every supplement, and see how that's going to affect your microbiome and how it's going to impact your health. And then based on doing all of that analysis with this digital twin of your microbiome, we can tell you what is likely to work best for you based on all of the world's knowledge today.
So I was fortunate enough to see one of an example of a result in your from one of your lab kits. And it was really interesting to me because I, as a health coach, I work with lifestyle components, right? And I really appreciated that you have links to all of these studies, but quite frankly, that could still be very overwhelming for a lot of women. A lot of women don't understand how to read studies. Is this study that is something that is even reliable to read? What does it mean between an observational study or a randomized controlled study, right? A lot of people, we don't know how to read all of that information. But what I really appreciated was coming down to the lifestyle interventions, right? Specifically foods to eat, or even lifestyle, right? Putting in mindfulness or exercise, focusing on sleep. So it had real tangible legs to it for just the regular everyday woman like myself that could understand.
Yeah, that's right. And what the AI is looking at is all the studies that have ever been done. So if there's a study that's looked at, a certain dietary change, introducing, beans or legumes into your diet, or high intensity interval training, or even getting a dog can change your microbiome.
Yep.
And because we know from all these studies how these things will change your microbiome, at least on average, then we can apply those changes to your microbiome test results and see which ones are likely to work for you and really present you that information. And you're right, we do link out to the original source studies and the science for people who do want to, get in deeper and really go deep, but you don't have to do any of that. I mean, that's the benefit of having the technology go and comb through all of those studies for you and interpret your results in light of them. But those studies are linked out there to like show the receipts effectively of where these suggestions are coming from.
Is there anything that your test doesn't take into consideration, right? So when someone gets back their results, does the test consider their maybe their ethnicity or their genetic makeup, things like that that would play into if you gave feedback on eat these certain foods or do this certain lifestyle component, it would conflict with something that they already know about themselves?
So there is an intake form, and based on the intake, we do take that into account. So if somebody says, I have a peanut allergy, we're not going to tell you go eat more peanuts, right? Even if that would change your microbiome in a positive direction. So we do take into account those sorts of contraindications, as they would say in a medical sense.
Hmm. Hmm.
Um, but we don't necessarily, but otherwise we're really driven by the core research and the core science that's out there.
Hmm. Very
However, I
interesting.
should point out, I mean, we're not taking into account, hormone testing or blood testing or anything else. We're really
Right.
looking purely at your microbiome and the information that comes in on the intake.
And for someone who takes this test and maybe they put 6 months of work in making these lifestyle changes, making these dietary changes, do they go back in 6, 8 months and retest to see if changes were made?
It really depends on the reason they did the test in the first place. There are basically three groups of people who are taking Jonah. So the first group are people who have some sort of health problem and they're looking for root causes, they're looking for solutions, right? And then there's a second group of people who are athletes or biohackers or longevity folks who want to look better, feel better, perform better. And then there's a third group of general wellness, where people just want to do a checkup and make sure everything's okay, and if it's not, then to get ahead of it. And I think the answer to your question depends on, what your purpose was in taking the test originally. So if you have a health issue and you're trying to find root causes and solutions and you're making the changes like you described, yeah, you probably do want to check in 3 to 6 months and make
Yeah.
sure that you've had the kind of changes that you were intending. And there may be, now that you've gotten your microbiome into a new state, you may actually want to adapt and modify the dietary and lifestyle changes that you're making to then get to the next level. So, you're only going to find that out by doing another test.
And beyond suggesting lifestyle changes and dietary changes, does the test also recommend different probiotics to incorporate?
Yeah, because we don't recommend specific brands though. So we don't make our own probiotics, we don't make our own supplements, and we don't recommend specific other companies. But we do tell you what the components of a probiotic that would be good for you would look like, and things that you should stay away from because you're already too high in those.
And so that's a really interesting part about your company is that you do not have your test flow into a whole line of products. You do not make any products. And so I really like that about your company because it really takes away from a lot of people feeling like, oh, I have to take this test or I'm going to this provider and then I'm going to be put into this funnel. And in that funnel is going to be all these other things I'm going to have to buy with their label on it. And
Right.
it becomes just this money machine and people start to detach from that and lose trust. How come you made that? Is that why you made that decision early on?
Yeah, that's exactly right. Within the microbiome world, I think there has been a lot of snake oil, honestly. Whether it's probiotics, there was a company called Ubiome that got shut down because they were committing criminal fraud. And people are rightly cautious, in how they make these decisions. And that's true with doctors as well. Uh, every doctor I've ever met is so excited about the microbiome and believes that it's the future. And at the same time, they're cautious about, what they
Hmm.
want to adopt in their practice and what companies they want to work with. And a lot of that comes down to trust, trust and credibility. And so for exactly the reason you described, we chose not to make our own supplements. We chose not to make our own probiotics. We also chose not to do affiliate partnerships where we're trying to, shuffle you off to another company where we get some kind of kickback on that as well. Um, and that's really about the trust and the credibility. And that's why we also link you out to all of the source material too. So if you really want to see where these recommendations are coming from, the AI will point you to all of the source material so that you can read the science yourself.
Yeah. And I love this because as a health coach, this makes my job a lot easier to support my client on their gut health journey. We have relevant information in front of us. They've done the test. They have a goal, a vision of where they want their health to be. And now we have some direction. We have some pieces to the puzzle to work on. And it's exactly what providers, practitioners, and health coaches alike will benefit in terms of their relationship and working with their clients.
Yeah, that's exactly right. We hear this a
Yeah,
lot too, and a lot of health coaches or practitioners, they're not just looking at the microbiome. They're also looking
right.
at hormone tests or blood tests or urine tests. And if they make a recommendation for a supplement or whatnot, it's based on looking at all of that information, integrating it together. And we don't want to get between the practitioner and the client ultimately.
I always talk about in my presentations that all of us have a unique health equation, and there's no one size fits all approach to any of this. And personalizing this approach is the way of the future. It's happening slowly, but it is happening. And I think this is just one component of that puzzle for women to optimize their health, especially moving through this transition of menopause. And women really struggle changing their diet, right? They've gained weight around their midsection. They're bloated, they're constipated, they have a lot of things going on, and it makes it really hard to pivot your diet and your nutrition and in a direction that's going to support you when you're used to doing things a certain way. Even if it's not working for you, it's really hard during this transition phase to break out of that model that you've known and that you've trusted for so long. And I love that your information is comes down to those bite size pieces. It doesn't all have to happen overnight. We can use some of the results and build a healthy foundation and just continue growing on top of that.
Yeah, that's exactly right. And furthermore, I think that it means something to somebody to know that a recommendation is really based on measuring that person's own biology. And in black and white, based on what we've measured and based on the science, this is what's actually right for them. And it's not just a generic, recommendation about how to eat or
Right.
how to change your lifestyle. That's really personalized to them based on measuring their own biology. I think people will pay more attention to that, and it's a lot easier to follow if you have trust that it's actually going to work for you.
Yeah, absolutely. One thing that was really interesting to me when I was researching to prepare for our time together today was that using AI to predict digestive orders or disorders, right, or predict disease. And so I want to have you make it clear that your stool test is not to diagnose anything,
That's right.
but it could predict something.
Well, yeah, so it's not a diagnostic. I mean, what we are doing is effectively connecting your microbiome to the current science. So if there was a study on depression which found that somebody's microbiome is got, certain organisms are higher and certain organisms are lower, and that's true of your microbiome, then we're connecting you with that study and saying, according to this study, your microbiome looks like it's got the signature for depression, right? And we do that across all of the different studies and all the different conditions. But it's not a diagnosis. A diagnosis ultimately needs to come from a doctor using clinical tools for that. Um, from the predictive side, very similarly, there are studies that show that if you go vegan, it changes your microbiome in a certain way, that certain organisms are going to go up and certain organisms are going to go down. And based on knowing what your levels are now, we can apply those changes to your microbiome from these studies, and we'll know whether that's moving your microbiome in a good direction or not. And we know we didn't replicate those studies ourselves, but we know based on the science that's out there how these dietary changes, how these lifestyle changes will impact your microbiome. And then we can say, for you, with your microbiome the way it is now and your levels the way it is now, is this going to be better for you or not?
So I find that really interesting because I do genetic testing with my clients, and some people don't want to do genetic testing because they don't want to know what their genes say. And so we all know your genes are your genes and they're not going to change, but it's the environment that we live in and the lifestyle choices that we make that impact how those genes are expressed, right? So have you had any feedback on using your test as a preventative tool that it causes or can increase one's anxiety over what the results might reveal?
We have from time to time. So, for example, um, there's a number of studies that have shown that there's a certain shift in your microbiome which is connected with early stage Parkinson's disease. And if somebody has that shift in their microbiome, we point out those studies and say, hey, your microbiome fits this profile of early stage Parkinson's based on these studies. And there have been some people that have, responded to that in a way of concern, obviously. Um, and we have to say to them again, this is not a diagnostic.
Right.
Um, go talk to your doctor. But at the same time, if this is a risk factor for Parkinson's, you can change it. You can change your gut microbiome through diet and lifestyle interventions. And we show you what those lifestyle and diet interventions are, again, based on all of the current science that's out there today. So I think it's more actionable and you have more control over it than you do of your genes, which are never going to change.
Yeah. The other thing that I was thinking of with women is women can become very restrictive in their eating, right? And especially around this time when we're gaining weight, we're not feeling good. We want to have control over something, and the food noise is real for a lot of women, young and in menopause and beyond. And I was thinking, has there been any insight or feedback on when the AI report comes back to someone? And it lists off these are foods that would benefit you, maybe these are foods that wouldn't benefit you. Looking into, does this create a more restrictive eating pattern for some women who might be predetermined to are pre-exposed to having eating issues?
I'm glad you brought that up because that was feedback that we got quite a bit early on. If we were saying you should avoid these foods, you should avoid
Hmm.
this, you should avoid that. A lot of the feedback that we got early on was, well, this seems very restrictive to me. And people were saying, well, what should I do? what you'll do differently. And so we really took that into account in as we iterated on how we presented all of the information. And we ended up focusing on more on what you should add to your diet and what you should adopt and lean into
Mm-hmm.
than on what you should restrict and take out.
Mm-hmm. Yeah, I agree. As health coaches, we always talk about what can we add. It's not really about taking out. It's what beneficial foods can we add in. So it's called crowding out. So I like that you know about that and have looked into that. I think it's really important. What's the experience for one of your consumers? They come to your website or they can go to a provider or a health coach like myself and get access to your test. But what's that experience look like for them?
So it's a kit that would either be handed to them by their practitioner if it's a brick and mortar location, or shipped to them directly if they were to order it online. And it's a stool sample collection. So basically there's an insert that you put on the toilet. It catches the stool. You basically take more or less a Q-tip and you put it in the stool. You put the Q-tip into a test tube. You seal the test tube, you flush everything down the toilet, and then you ship off the test tube to the lab. So if anyone's ever done Cologuard or something like that, it's exactly the same process.
And then what happens in terms of they send the kit back to you, and then what's that turnaround time like, and what does that report look like? And also, one of the things I know about your company is that because there's 2,000 papers that are released every month on the gut microbiome, you are constantly updating your database.
That's right. Yeah, so you get the results back in 2 to 3 weeks. If you ordered through a provider, the provider will get those results first, and then they would review them with you and release them to you. If you ordered it directly, then you would just get the results yourself.
Hmm.
And you get emails along the way telling you, status and your sample is received and your results are ready and so on. Um, and then what that report looks like is we really look at how your microbiome is impacting your body in multiple different ways. So we really focus on brain health, on gut health, on metabolic health, on skin health, and on physical performance. And so within each of those categories, we show you how the signatures of your microbiome are related to a variety of different, brain health conditions, everything from anxiety and stress to depression to ADHD or Parkinson's, right? And similar with GI health and metabolic health. And then there's also the action plan that pulls together all of the analysis of how you can change your microbiome in a positive direction that you can access, and that will really tell you in rank order of importance what dietary changes you can make and what lifestyle changes to make.
Right, but the person is the client is connected to your some type of online program, right? So when all these papers are coming in and updating information, it's also updating your results.
That's right. That's right. So the results will keep pace with all of the studies that are coming out. So if you come back in a month or two, you may find that the results are slightly updated if there's new science in that time. Now, things tend not to change dramatically.
Right.
If you take something like I was just looking at anxiety earlier this morning, right? I think there's 16 studies on linking the microbiome to anxiety, and they find roughly the same characteristics in your microbiome are linked to anxiety. So it's possible that some new paper would come out, some new study that's a massive study published in the New England Journal of Medicine that completely throws out all of the previous science, and that might change your results on anxiety, but that's very unlikely. It's more likely that we'll see additional refinements of those results. We'll see more studies that add to the growing body of evidence and slowly turn our understanding of what anxiety looks like when from the standpoint of your gut microbiome. But yeah, all
Yeah,
of the results stay up to date. Obviously, like if you come back a year later, we're basing the results on your microbiome a year ago, and it may have
absolutely.
changed. So they may not be as relevant anymore, but they will
Right.
be updated.
Yeah, that's really cool. And you mentioned physical performance, and I was just reading an article on a microbiome company that located a strain that is associated with sports performance, and that a lot of the high-level athletes have an abundance of this strain. It starts with a V. All those names are so complicated to say, so I'm not going to try to butcher it here. But I thought it was really amazing because women in midlife, what is from health coaches to other practitioners, we are all trying to encourage each other to move more because as we age, it gets harder and harder to build that lean muscle mass, harder to achieve the body composition that we want. We're experiencing more fatigue, more joint pain, inflammation. And so I love that this company was actually coming out with a product with this specific strain. So, there might be a little bit marketing kind of noise around that, but it's a really interesting thought.
Yeah, it's shocking, honestly, that your microbiome has been linked with joint pain,
Hmm.
back pain, with chronic pain in
Hmm.
general, with fatigue, with chronic fatigue syndrome, with brain fog. Um, and even from a sports standpoint, things like VO2 max and your endurance have been linked with what we find in your microbiome. And in fact, many athletes end up developing gut issues. It's the number two issue that faces athletes behind fractures and actual like damage to their body.
Hmm.
Because you can overtrain and you can mess up your microbiome, or they go on diets that end up being too restrictive, and it can actually really cause problems with their performance.
Yeah, very, very interesting information coming out. What is coming down the pipeline for you? I know you're not going to go into developing a whole line of probiotics and gut health supplements, but what else in maybe even in terms of women's health?
Well, there's a lot with women's health and the microbiome. So this is another focus area for us actually right now is launching a women's health module as well, which will look at things like cystic fibrosis and PCOS and some of the other elements that are related to menopause and perimenopause as well. Um, we also want to make the product more interactive and more, engaging for somebody's daily life. So we're going to be adding generative AI for doing meal planning. So taking in all these recommendations and saying, okay, well, here's a meal plan of breakfast, lunch, and dinner that actually matches all the different recommendations for fixing your gut and allow you to modify it based on your own preferences and what works in your own lifestyle as well, and then allow people to be much more interactive with the AI and ask it questions and all these sorts of things, really to provide somebody more of a companion to help guide them in their daily life beyond just getting a test and a test result.
That's such a great idea. Meal planning is something that always comes up in my sessions with my clients, and to allow someone to have more autonomy over their lifestyle choices and how to put a meal together without always, having to be in a session with a health coach or a practitioner. That's huge, and also because I can see a lot of people thinking, oh, I'm going to go take this test, I'm going to get these results back, and I'm going to feel really overwhelmed really quickly. So I really like that stream of really personalizing a meal plan and making it simple using AI. That's a great idea. What about wearables? Is there an interaction now between the test results and somebody's wearables?
There's not now, but it's something we've been asked about and thought about. And so we may launch an app in the future that can integrate some of the information from your wearables and your sleep patterns and your activity patterns, and also be a little bit more actionable on a day-to-day basis. Maybe scan a barcode at the grocery store and see like how is this food going to impact my microbiome and my health, and really provide a tool that's a little bit more of a daily use and than just a test where you get the test results once and then you walk away and you never think about it again.
Or even just scanning probiotic products on the shelf. There's just a
Um,
sea of probiotics in the
oh
fridge,
my
on
God,
the
yeah.
shelf. People are so confused over which ones to take. And as you know, there's a lot of noise in that space. And, not very good products that people are spending good money on. So that'd be cool if you had an app and you scan the product and it's sort of like a flashing red light, do not buy, right? Maybe something a
Yeah.
little less severe. I have one more question here. Does your does your company accept HSA or FSA in terms of purchasing? Oh, that's wonderful. That's huge for women.
Yeah, yeah, absolutely. It's something that's really important for a lot of people, and
Yep.
more and more healthcare spending is shifting into that HSA, FSA world,
Yep.
and so it's something that we were very focused on being able to bring to people.
Yeah. Well, Leo, thank you so much for joining me today and sharing Jonah Health with us and AI and how this is going to impact and benefit the menopausal journey because, any little bit that can help us is, something that we're going to be open-minded to. Any final words on gut health and women that you want to share with us?
Well, the majority of our customers are women. It's two out of three folks that are coming to us are women, and I think women are much more impacted by gut issues. The predominance of autoimmune conditions affect women much more than men.
Yep.
And I think women are also take more responsibility for their health and pay more attention to what they eat. And the gut and gut health is really the conduit between the choices you make there and how it affects your health. And so I think women do a much better job of this than men generally,
Yeah.
but they also are more dramatically impacted by it than men are.
Absolutely. And, there's a lot of women who don't want to take hormones, right? We're learning a lot of beneficial information to taking hormones at certain times in a woman's life and who's a candidate and who's not. But for women out there who really don't want to, this is just an extra measure to take for overall health and wellness and longevity to support their journey because we do need a lot of help during this transitional period. And we know how huge diet plays a role in all of these chronic disease states that you mentioned before.
Yeah. Yeah, absolutely. I mean, the chronic disease has been on the rise for the last few
Yeah.
decades, and our food supply, our eating habits are clearly part of the reason for that.
Yeah, absolutely. Well, thank you again. And I am an affiliate with your company, so I will put that in all of our show notes so people can use that code and go to your website and try your test out. I'm actually going to give it a try myself. I'm very intrigued by all of it, and I've done other stool testing before, but I really love the science behind yours and all the knowing I'm going to have all these links out to read really specific information that applies to just me. So amazing. Thank you so much. And everyone, thank you for joining us today.
Thank you, Jill. And thank you for the work that you do for everyone as well.
Thank you. Thank you for joining me. I hope you enjoyed the podcast. Lifestyle changes can be hard and overwhelming to make. By building your support team of functional medicine doctors, therapists, and health coaches, you can reach your optimal health goals. Be sure to check out my other podcasts. Until we meet again, stay healthy.